Hello and welcome to Health and Lifestyle. My name is Marie Yambo. Always a pleasure to have you join us. Our social media handles at Marie Yambo at KBC Channel 1 on X and KBC Channel 1 TV on Facebook. The year 2024 saw a revamp of the health show, From Your Health to Health and Lifestyle, bringing you real life stories, experts take word on the street, where we sample some of your opinion on some of the programs that we aired, and also a guide to a healthy lifestyle on good practice. We begin the year in review with a visit to Enso Sound Studio, where we learned how sound therapy is enhancing mental and overall well-being. But first, let's take a look at the transformative story of baby Joy, who was born with a cleft lip and palate. A group of surgeons gave her a new lease of life. For Raila Koth, the first few months of her daughter's life were filled with worry.
Wakati nilimzaa tu immediately vile niliambiwa confirm the baby, nika realize kuna kitu imeniguara kwa kifua. Kuangalia nikaona ni gap, akona gap. Kusema ukweli nilistuka. Juu sijawahi ona kitu kama hiyo since nizaliwe. It is my first time. So pressure ilipanda. Ikabidi nipelekwe kwa consultation room, nikakonsultiwa, wakawa wanapima pressure, wananiconsult hivyo, then wakanipeleka kwa room ya wale wenye wako na shida kama hii. Nikaona they are worst than mine. So nili take courage from there, nikakubali the baby. Nikaambiwa nijaribu kumnyonyesha, nikaona at least anashika matiti, anaweza vuta kidogo.
I had my first period when I was 14. And I remember it, and I was very overjoyed because that time, you're maturing, you're a girl. I had no pain. I never used to have cramps, even the normal cramps you get here on your abdomen. I never used to have them. The first time I experienced pain, ridiculous pain, was in 2010 there. I had shooting, stabbing pain on my back area. That is the bum area. And I remember I visited a gyna, but then that time endometriosis was not known. I remember I Googled the exact words, shooting, stabbing pain in the bum. And the first thing that came up was endometriosis. And when I told my gyna my symptoms, he said, this actually sounds like endometriosis, but he wasn't sure. So even the tests that he did, the scans, everything, it didn't show.
With my first two pregnancies, my tummy went back to normal. But with my third pregnancy, it was a really huge pregnancy. Oh my days, I looked like I'm carrying 4 babies. But it was just one baby, and it pushed my muscles so much. Initially, when I delivered, I had a lot of back pain. It was an emergency CS. The other 2 pregnancies are normal births, but this one was the last one was an emergency CS. So I was trying to figure it out, like it's my CS, because I had not experienced it before, that is making me have the back pain.
And it was not just the back pain she was concerned about.
I sing in church, so I'm used to jumping in church. So whenever I just jump, Susu is passing. So whenever I could cough, I could drip Susu.
Located in the leafy suburbs of Kitisuru in Nairobi, the melodies of the singing bowls, the vibrations of the gong, echoed through the Enso Sound Immersion Studio, where my colleagues and I tried sound therapy. During the sound therapy, Alia Datu, a doctor of metaphysics, played instruments.
So whenever somebody comes here, the first thing I tell them is be open to the experience, and secondly, surrender and let go to the sounds.
But what is sound therapy?
So I'll tell you what, Marie, we are made, I think 75% to 80% of our bodies is made up of water, right? And sound basically creates ripples. It's like you take a pebble and throw a pebble in a still lake and you see the ripples going all across the lake. That's what sound does. And it creates vibrations in your body, so your body feels those reverberations of different instruments and sounds.
I've just arrived in Fulo village, a semi-nomadic community in Buna sub-county, that is in Wajir North, where accessing healthcare can be a challenge. Community health promoters like Hussein Osman are bridging the gap. Under the Nomadic Community Health Promoter Project, an initiative of the Save the Children, Hussein has been trained to handle minor ailments.
Tunaangalia kwa community defaulters, immunizations, tuna treat minor illness.
However, referring complicated cases can be a challenge.
Shida ni moja. Hiyo shida ni wakati sasa wajawazito tukipatikana shida hapo. Hiyo shida sisi hatuwezi, lakini kazi yetu ni kurefer.
A few years ago, these women were a dejected lot. The drought situation had devastated their lives, leaving their children hungry and malnourished. But today, with the help of partners, they are able to support their families. Camilla's family has benefited from several of such programs.
Hiyo wakati mimi mtoto yangu alikuwa mwaka moja, alikuwa very weak kwa sababu ya njaa. Sasa hiyo wakati walinianzia hiyo pesa, mimi hiyo wakati nilikuwa na stress, nimetoka town, sina kazi, nilikuwa naishi kwa nyumba ya bwana amenitoa kwa ile nyumba, nikakuja nikaishi hapa. Stress yangu ni mingi, watoto ndo hawa, ng'ombe imeisha, ukame iko mingi. Sasa venye hiyo pesa ya save ilikuja hiyo 1500, nilipoteza na stress.
Perhaps alive to the reality that receiving the funds may not be sustainable, she opted to think outside the box. The last tranche she received under the program was 13,000 shillings, funds she opted to pump into business. She partnered with a friend whose story is not different from hers, and together they saved and raised 60,000 shillings, which they used as capital to buy this cow and embark on dairy farming. And the program is never complete without a take from you, the audience. We sample some of your sentiments on Word on the Streets.
So to keep shape, you can, if you are fat, you can diet and do exercise at the same time, and also use the food supplement like Burn Slim, those. But you cannot use medicine alone. You use medicine and exercise and do some diet.
Having a 2-year-old, I had a lot of weight, and my stomach actually was very big, and I did some exercises. I tried some dieting, and I really didn't know which one worked, whether it's exercise or it's the dieting.
Nimesikia tu hata watu wanasema hii kitu inakaa kama corona bwana, lakini kwa media ndio nimesikia. Sasa tunashuku kitu kinakaa kama corona. Wakiona kitu yenye sio kawaida, you have to visit the hospital.
I've experienced it when I was younger, when I was in primary school back then. I never knew what it was at that time, but I used to, you know how parents can be, a lot of medicine is not good for your body and everything. So yeah, my parents used to recommend me a lot of camel soup. Yeah, and it got better with time, because right now I rarely experience that.
The process of giving birth is not easy. So for the mother, the type of giving birth, maybe CS or normal birth, it can lead to such depression, and hapo ndio atashindwa hadi kunyonyesha the child. Yeah.
I myself currently know about, I do not even know anything about it. So I think I should do more even research myself. But even the government should do more research and give us the public announcements. To kila saa during programs, like the way they're doing for Corona. At least they be telling us, updating what are the symptoms, how it comes, all that.
On that note, let's take a break, but when we come back, we look at some of the expert views and also the good practice segment. Welcome back and thank you for staying with us. In our expert segment, we take you down memory lane and we start with Dr. Maronga as he explains how your oral health affects your overall health.
There is a correlation between poor gum health, commonly known as periodontitis, and also diabetes. It's been shown that diabetes is worse in people who have poor oral health, especially periodontitis. There is also a correlation between poor oral health and poor outcomes of pregnancy. For example, people who have poor oral health during pregnancy are more predisposed to preeclampsia, and they are also exposed to the possibility of having preterm babies and also babies who are underweight.
Diastasis recti is basically the separation of the abdominal muscles. The abdominal muscles, they meet at the center of the abdomen. So, and that area there is not really muscle, it's a different type of tissue, which is called connective tissue. Connective, it connects the muscles. So when that tissue separates, that is when you have diastasis recti.
The biggest concern we see in females in Kenya, or I would say African females, is something called traction alopecia. Traction alopecia comes from the braiding, the weaving, which is years of pull, and that pull is what allows or what causes the hair to be lost. So you'll often see that most African females lose hair bandwidth, which is just in the front, as opposed to when we talk about general balding, which is also a form of alopecia, known as androgenetic alopecia or androgenic alopecia, that you will see people start balding from the center. And so traction with females is the most common alopecia. That's where we help the women to regrow their hair. It could be through the stem cells or the growth factors, or sometimes a hair transplant. The second one is the androgenic alopecia, which is just actually balding. Balding can be because of anything: age, genetics, lifestyle, stress, majorly those concerns. And so that will cause balding, what we say kipara. And otherwise, there are other different types of alopecia as well, which are alopecia totalis, universalis, alopecia areata. But these now have different treatments. Not a lot of people suffer from these, so they're less common as opposed to the androgenic and the traction.
Cleft lip and palate is a group of diseases that affects the mouth. It's a congenital disease. Congenital meaning that patients are born with the defect. It can either affect just the lip only or the palate, which is on the inside of the mouth, or what we call the roof of the mouth. So patients would tend to have a break in the continuity of the lip or the palate on the inside of the mouth. Because if you think of your mouth and your nose as two different floors, for example, in a house. So the mouth has a floor on top of, has a roof, all right? And then on top of that is your nose, okay? There are two different chambers normally. When a patient has a cleft palate, then there is a break in the roof of the mouth. So that's wet, so it's separated. So as opposed to the roof being like this, it is separated apart. So what that means is that you have a communication between the mouth and the nose. That is the cleft palate. And the cleft lip, like you said, is something that you can just look and see, that there's a break in the continuity of the lip.
What's going on is a detailed endometriosis excision surgery at the moment. We are proceeding with hysterectomy for this patient because of severe endometriosis. As you can see behind, it has involved the bowel and pulled it in. It has pulled in the appendix. It's a big mass now. There is a big endometriotic cyst in the ovary. There are fibroids, these adenomyosis. So everything just gets pulled in and becomes a mass. So what is going on now is using 3D technology, which is why I'm wearing these glasses. Using 3D technology, this patient is undergoing a laparoscopic excision of the endometriosis.
We have oropharyngeal cancers, and oropharyngeal cancers are more common in men than women, but it also causes penile cancer. Penile cancer is rare, but it's terrible, a terribly painful cancer to have. So men also suffer, and warts. I tell people warts won't kill you, but they're not pretty, and they're not nice to have. And those can all be prevented with vaccination.
Although mpox can be passed from animals to humans through handling or consuming an infected animal, what is happening this time round is that it's being driven largely by human-to-human transmission.
The mode of transmission that time was mostly discovered to be sexual. But now, over time, as the mutations kept going, there are other modes of transmission that are now being seen. So things like, skin-to-skin contact with someone who's been infected, close contact with droplets, behavior such as kissing, and then also in pregnancy, a woman who is infected can easily transmit through placental transmission to the unborn fetus. So it's now become a very multifaceted transmission cycle, and it's no longer the traditional animal to human that we thought about. So now there's but it's mostly close contact.
So following to the notification of mpox outbreak in DRC Congo and other neighboring countries, and subsequent confirmation of the one case in Kenya, the Ministry of Health, in collaboration with the county governments, have instituted relevant preparedness and response measures, which include, and not limited to, the strengthening of the coordination amongst the national government players and the county government players. Remember, the one case that was detected was actually in Taita Taveta. So what we did was to give support to the county to ensure that we have a lot of surveillance around there, increased screening of every passenger or every traveler who is coming into the country. So we have activated our Public Health Emergency Operations Center, and we have 25 others across the country. Then we have also enhanced our surveillance in the 47 counties and all points of entry.
Yeah, I think motivation of CHPs is really very important because they do a lot of quality work at the community level. They have been very, very helpful in supporting and providing basic healthcare services at the lowest level. And the governments, both the national and county government, are mandated to provide motivation to these CHPs through the various laws that we have in the country that guide the universal healthcare coverage. So as Wajir government, I will have requested they put in place the Community Health Service Bill, and they pass it into law, which will have guaranteed the sustainability part of the community health promoters' work. And this will also ensure that CHPs receive monthly stipends that is stipulated in that particular bill.
On Health and Lifestyle, we endeavor to bring you ways to adopt a healthy lifestyle on our Good Practice. Oral health featured prominently on our Good Practice segment.
In the Kenyan market, we have also seen something that we refer to as mswaki. Mswaki is actually a herbal branch or stem that people can chew and use to clean their teeth. This is also something that can work just like your toothbrush.
Now, any amount of meat, more than 150 grams per week, say give an allowance and give it to 200 grams per week, more than that, consumption is going to be increasing the cancer risk. We know that one of the prime reasons for having cancer, apart from tobacco and alcohol and other infective process, is lack of a good physical routine. Adults need to have 300 minutes of moderate intensity aerobic activity per week.
Here are 5 steps we can take to develop healthier social media habits for our well-being. Number 1, turn off notifications. 2, set boundaries and time limits. 3, clean your social media feed. 4, limit social media time before bed. Last but not least, focus on what you're grateful for. It's been my pleasure hosting you on Health and Lifestyle. On behalf of everyone who has made this program possible, of course the production team, those who shared their personal stories, and the experts, and of course you for always tuning in. My name is Marie Yambo, and as 2024 comes to a close, I want to wish you all the best and success in 2025.